Yeah, hello and a very warm welcome back to my channel here. This is Frida. In today's video, I'm going to give you a podcast conversation that I recently had with Dr. Hashir Aazh. He is a UK tinnitus specialist, and that I'm not saying something wrong. Yeah, he's a UK tinnitus specialist for tinnitus and cognitive behavior therapy. As you know, my name is Frida. I was born deaf on my left ear. I have been living with a severe tinnitus and a hearing aid on my right ear for the last 15 years. I'm also the founder of outeringtinnitus.com and mytinnitus.club, a tinnitus coaching practice and an online tinnitus membership community. In today's podcast episode, I'll be talking to Hashir Aazh from the UK. He's got a very, very big tinnitus clinic there, and he has helped hundreds, if not thousands of people from the UK, but from all over the world in his tinnitus program. And today we're going to get into how he does that. He shares everything that you need to know, how CBT can help you, relieve you of that vicious cycle of tinnitus distress, and how the tools of cognitive behavior therapy actually do that. One thing before we jump into the episode, I want to offer you out there, if you have seen it, maybe a few weeks ago, I released my book on tinnitus called Accepting the Unacceptable, an 8 weeks journey towards tinnitus habituation. I'm giving away the book for free right now for everyone who signs up to our tinnitus membership community. So if you're anyway looking for tons of habituation advice and weekly videos, exclusive inside the community podcast episodes, online courses on how to tackle tinnitus habituation for you, so tinnitus goes into the background and stops bothering you, including weekly group coaching calls, and you want to get my book for free, then we'd be super excited if you go to the link in the description. There's a link where you can find a link to the free trial to our community. If you sign up and stay on for the month, then we send you the book immediately after signing on, and I'd be super happy to hear your feedback. If not, if you don't want to join the community, if you just want to get the book, you can get to tinnitus-book.com and get that right there as well. But without further ado, I wish you a lot of fun with the podcast interview that is also launched on my podcast. So the whole version is a little bit too long here for YouTube. But if you want to listen to the whole version, then you can find the Outring Tinnitus podcast on all major podcast platforms. And listen to the whole hour-long conversation. If not, stay here and watch the video with Dr. Hashir Aazh from the UK, and he shares his insights on how he and in his practice tinnitus and cognitive behavioral therapy are used for people with distressing tinnitus, and how you can really using these or start applying some of these techniques in order to get better with your own tinnitus. Finally, there's also some links in the description below where you can get free resources, including my free guide or my 100 hacks to tinnitus habituation. So just find the link in the description, and yeah, you'll be set. All right, enjoy the video.
Again, just for anyone who's not part of the community, I mean, your community is fantastic. I just recently joined, so quite new to the community, but it's been amazing, and all the content and help you have in the community is also amazing as well. You've been honestly, you've been that little light at the end of the tunnel. So just thank you so much. I mean, it's a journey, and it's not an easy journey, but there's that light at the end of the tunnel. So thank you.
All right, then welcome back to the Outring Tinnitus podcast. Today, I'm very excited to have another tinnitus heavyweight on my podcast. Today, we are joined by Hashir Aazh from the UK. He is a tinnitus specialist for many, many, many years, and we're very excited to having him today on the show. Hashir, just please introduce yourself a little bit to our audience. Nice to have you.
Well, thank you very much, Frida. Thank you for the nice introduction. By background, I'm an audiologist, and I throughout my studies, I always were interested in areas that in audiology that needed further research. And tinnitus was among the key areas in the field of audiology that there are so many unanswered questions for it, whether it is about what causes tinnitus, or how to treat tinnitus, or how to prevent tinnitus, as well as how to diagnose tinnitus and objectively verify that somebody has tinnitus. So there's so many questions that one can do research, and that was very inspiring for me to actually, when I get to this field, to be able to study something that is not fully understood, something that I can add to the accumulative knowledge of research field and clinicians. And that was how I became interested in working with patients who have tinnitus, as well as doing research and teaching to other clinicians about the methods that I've developed for helping patients with tinnitus. Along the way, there were other conditions which were quite coexisted a lot of time with tinnitus, such as various forms of sound intolerance disorders, mainly hyperacusis, and also other forms of sound intolerance disorders like general noise sensitivity, as well as misophonia. And so these were all the bulk of conditions that, through this path of tinnitus, I got to understand them as well and work on them.
That's fantastic. I always try to say to everyone who comes onto the podcast and to thank them, because there are, there is a little bit of a misconception about how many people are really working on this. And I certainly believe that it's a lot more than people are led to believe. They're always led to believe that 30% of the population are left to deal with this alone. But there are so many practitioners such as yourself who devote their life and professional career to really helping and supporting people. So from the whole community, because I'm also part of this tinnitus community, I want to thank you for all the work that you've been doing. And it's very, very important that people like you do that. So thank you for that. I think it's important to say that as well.
Thank you.
I just want to ask you, was there any special interest in tinnitus? Did you have a personal relationship with tinnitus, or when was the first time you heard about it? Or how did your personal relationship with tinnitus develop? Out of curiosity.
I started become interested in tinnitus way back when I was doing my bachelor's degree in audiology, and I did not have the experience of tinnitus myself or any of my family members at that point in time, and but I was very keen in doing reviewing of various articles and writing a little review for our university student magazine. And I happened to come across a study about history of tinnitus, and I realized that Beethoven had tinnitus and severe hearing loss even when he was doing some of his best writing some of his best music. And that was, I became very interested in tinnitus, and carried on studying about it and read other papers, and then engaged in research myself. I have experienced it myself at various points in my life, and I have very close relatives who have tinnitus, and of course I see thousands of people with tinnitus so every day, so I do my best to understand their experience as much as possible, and to see the problem from their eyes, so this way I got closer and closer to this phenomenon, if you like.
Very, very important. I think one of the things that when we can offer a helping hand, and first of all, understanding what people are currently going through, but also showing them that it's not so isolated, but it's that a lot of other people also experience it very similarly. I mean, I had Dr. Craig Casper. He's also a fantastic audiologist from New York on the podcast, and he said something very striking to me. He said, when you have one patient with tinnitus, then you have one patient with tinnitus, right? Because everyone develops it a little bit differently. Everyone has a little bit of a different form with their tinnitus. Everyone has a little bit of a different belief system and how their tinnitus manifests in their everyday life, and the areas that are influenced and how they react to it. So everyone is a teeny tiny bit different, but that also makes it so interesting to work in this field, right? So I think it's incredibly rewarding and interesting to also be working with so many diverse people, but to always have the common denominator of being able to show people that they're A, not isolated, and B, that there are very, very good strategies in helping people deal. So what is your relationship to the normal ENT statement? There's not so much we can do. Please go home and don't stress out too much about it. Is that something that you've heard quite a lot in your career, seeing patients, or what's your relationship to that statement?
Yeah, I have had that a lot. They are right. ENT doctors hardly can do anything to tinnitus, and even sometimes that tinnitus is as the result of some obvious mechanical malformations within the ear, or is related to the arteries close to the ear or muscles. It is usually a very high risk to actually go in and try to stop this noise, and for obvious reasons they hesitate to do this unless it is a dangerous thing, that whether it was tinnitus or not, they had to go in and get rid of that problem. So as far as the ENT is concerned, usually unless there is an infection in the ear that they can treat, or earwax that they can remove, if they can't see anything really wrong in the physical appearance of the ear, then there is really little that they can do. And the fact that they say don't stress about it is true as well. Only if people could do that. And some people can. Some people, when they see their GP or their ENT doctor, and they check their ears and they say, okay, there's really nothing wrong. There may be a tiny hearing loss that you have. Your tinnitus is not related to any sinister cause, so you don't really have to worry about it. This reassurance that they give to them, and they hear it from a medical profession at that level, can do the trick for many people. And so I do think that they do a huge service to a majority of the people who have tinnitus, because majority of people who have tinnitus, they may not be that much bothered by it. And there's a minority of people who have tinnitus who become significantly affected by their tinnitus. But this minority is a big number if you look at it. And so for these particular people who are experiencing distressing tinnitus, and they are these impacting on their concentration, on their sleep, on their relaxation, recreational activity, relationship, so on and so forth. For these people, advising them to, not to stress about it is a good advice, but they can't really do it. Yeah. And so they need more. It's like telling a depressed person not to be depressed.
Right.
And, it's not about
exactly. It's the same like saying to someone, you're overweight, you need to lose weight, but not telling them, hey, okay, so this implies you need to start walking more steps, you need to eat healthier. And so it's just the doctor says you're overweight and you need to do something about it, but it's actually not the doctor's job to tell the person how to exercise and what to eat. It's just, the diagnosis is there, but then it's the person's own sort of way to dealing with this, and which is I guess difficult and also frustrating for doctors sometimes, right? If there's not an immediate and quick fix they can offer to the patient, because that's what doctors and most doctors are taught in medical school, right? We have a condition, we have a mechanism for solution, and most of the time we pull out a piece of paper, give a prescription, and then the person gets the help that they want to get. And tinnitus is much more complicated, and they would potentially also need a lot more time in order to explain how they could go about solving this problem or getting further help. And so I'm just curious, if someone comes into your office and starts working with you, a patient, what are you usually what do those steps usually look like for you in your process?
Do you mean in my own clinics?
Yes.
Yeah. So we again, we receive the referrals from ENT surgeons or psychiatrists or neurologists who see these patients, and they identify that this patient is really distressed. So when I tell them just not to be worried about that tinnitus, that doesn't do the trick. So then they have to refer that to a more specialist service, which basically can help these patients to cope better with their tinnitus. So patients who arrive in our clinic, most of them have already undergone medical investigations, whether they have anything that is an identifiable cause for the tinnitus, or an idiopathic tinnitus, which there is no obvious cause for it. But still, when the tinnitus bothers them to a certain level, they get referred to us. So our job is mainly to, it starts with trying to understand whether the distress that this person is experiencing is related to their tinnitus, or is it related to something else? Because somebody may present with lots of distress, and they come to your clinic, they are very anxious, they also have tinnitus. But the source of the distress and anxiety may not be tinnitus. Maybe, I don't know, another hearing problem. Maybe it's their hearing loss. They think there is tinnitus that doesn't let them hear better, for example. Or maybe it is a balance problem, that they don't feel confident that they can walk or go outside or something else. Or the source of the distress may be an underlying psychiatric condition, or a social problem, or a family issue. So this is the main task that we have in hand, to see if the distress that the patient is experiencing is that direct result of their tinnitus, or is because of something else. If it is as the direct result of their tinnitus, then a specialized cognitive behavior therapy approach is going to help them to basically break that vicious cycle that is causing the distress from their tinnitus. But if the distress is linked to other things, they need other forms of therapy, which we usually make an onward referral to other colleagues who can look at whatever problem that they have. If it is a physical problem that can be sorted, obviously that takes the priority. If they need a hearing aid, for example, if they need a balance rehabilitation, or if it is a general anxiety problem, or a panic disorder, or a form of obsessive compulsive disorder, or even psychosis, then a psychiatrist or a psychologist will be better placed to help this patient. So although the patient has tinnitus, but the tinnitus is not cause of the distress, it's something else. So that person can help them more. But when tinnitus is the source of the distress, then a CBT approach, which focuses on understanding the mechanism that distress is produced, and helping the patient to disrupt that mechanism, is basically what we try to help with.
Yeah, 100%. And I love that so much. Putting the foot in the door of tinnitus distress, and sort of like getting the person to realize that vicious habitual cycle that just repeats over and over again, produces the same thoughts, produces the same emotions, and therefore chemical reactions in the body that drain us of the energy and send that signal to our brain that we're really dealing with a very threatening and difficult problem here, and just repeats over and over again. So without getting too much into that, could you share a little bit about what that CBT framework looks like for the patients? I've talked on this podcast a lot about sort of using CBT. I use my sort of own removed tools of CBT, and I think everyone uses them a little bit different. So could you share with us how that works for you, just as a general overview of what the people might benefit from when they come to see you at your clinic?
Yeah, absolutely. And so there is a distinction between CBT approach and approaches similar to CBT, like acceptance and commitment therapy,
sure,
mindfulness. That basically these are the approaches that are trying to help the person to face up with the challenge and deal with it. And but there are different approaches which are available as well, like sound therapy, which are often prescribed by audiologists who help patients with tinnitus. But that approach is a bit different, because in the context of CBT, that becomes an avoidance behavior. And so the person, although they kind of get distracted from their tinnitus by listening to a different noise, and it can provide a short-term relief, but it doesn't let them to learn how to basically cope with their tinnitus, how to deal with tinnitus, and the anxiety that I cannot deal with this impacts on me, maintains. And so for some people, it can be beneficial, that short-term relief, and giving them the opportunity to put themselves together and just move away from this problem. But if the person is really affected by their tinnitus, usually those kind of approaches doesn't really do the trick for the person. So in CBT,
I like just a quick thing in between. I love that so much that you said that, because I get this question often, what I think about sound therapy and removing yourself from the situation of experiencing tinnitus. And I say short-term relief, if you need it for sleep at the start, when you start dealing with tinnitus, perfectly fine to curb that massive spike in anxiety. But in the long run, when you want to put your brain into the position of not having that constant negative reaction towards your tinnitus, then sound therapy can actually be detrimental to the process. So it's great to have someone who has a similar opinion to this. So thank you. Sorry for interrupting.
No, that's fine. Definitely. I think it does delay the process of habituation, if you like. And also in theory, there are some suggestions that it actually facilitates habituation. I think it delays it because you need to get to this point that you are not classifying the tinnitus signal as a threat. And you have to work on the reasons that you are classifying the tinnitus signal as a threat. And to do that, you must be exposed to this problem. And this is the case not only for tinnitus, for a lot of different problems. Avoiding the actual problem is only a short-term benefit. If you have back pain, the natural thing is to avoid the pain, try to rest. But you go to physiotherapy and they'll tell you, no, you got to move, you got to do these exercises, but it hurts. That's fine. You have to go through the pain. And when you do the exercises, you're enhancing your muscles, and then gradually the pain reduces because you enhanced your back muscles. Or if somebody has obsessive compulsive disorder, and it helps them to wash their hand 1,000,000 times. Every time that they do it, obviously it helps them. If it didn't help them, then they wouldn't be doing it. And but then this becomes a ritualistic behavior, same as avoidance behavior. Ritualistic behaviors also maintain the problem. So they need to expose themselves to the things that they're afraid of, like the dirt or the unhygienic things, and stop their ritualistic and avoidance behavior. Sometimes sound therapy and using this app and that even doesn't help them to avoid their tinnitus, but it becomes a ritual. And it is not only sound therapy that can become a ritual. Sometimes people look for information as a ritual. Information seeking becomes their ritual, and somehow it helps them because it gives them the confidence that I'm doing something here. I'm being proactive.
False confidence.
And that somehow helps them to as a short-term things. But in the long term, and not only for tinnitus, with any sort of condition, that you have to learn to cope with this. Avoidance behaviors and ritualistic behaviors may backfire and doesn't help the person to move forward. Going back to the CBT, and which is consistent with this conversation that we had, is the first task in the CBT is to create a list of the avoidance behaviors and ritualistic behaviors that this person is doing, and then plan how to stop or reduce these during the therapy. We usually try to find out the avoidance behaviors or rituals that they're doing, the reasons that they are doing it, what is the fear behind it, and how difficult it is for them to start that particular behavior and rate them, and then start from doing different behavioral experiments in order to basically get rid of those behaviors, starting from the behaviors that they rated as easier to stop, reaching to the behaviors that they were most difficult to stop for them. And this is the behavioral element of cognitive behavioral therapy. And the cognitive component of it is to help them to understand what are the thought process that goes through their mind when they're experiencing their tinnitus. And they learn various skills to help them to identify their the thoughts which are very much directly linked to their distress of the tinnitus. And these thoughts are, according to cognitive behavioral theory, there are various different forms of thoughts. One is automatic thoughts. And it is believed that automatic thoughts are the ones which are directly linked to our emotions. Obviously, underneath the automatic thoughts, you have the rules of life or intermediate thoughts, and then the core belief that are often created in childhood. So the person during the process of CBT will get an understanding of how to identify their automatic thoughts, their rules of life, and their core beliefs, and learn skills in order to modify them. In terms of the automatic thoughts, the intense emphasis of the CBT protocol is often on automatic thoughts for problems such as tinnitus. For problems such as a personality disorder, then maybe the intense focus will be on the core beliefs of the person, and there is a fundamental change that needs to be happening in that. But for tinnitus, which in the bulk of psychological problems is not one of the deepest part of the psychological problems, is mainly a distress that is caused by a health condition. Effectively, the person is not suffering from hallucinations or delusional thinking and things like that. So they are simply distressed by this noise they're hearing, and anybody would be if they were hearing something like this in their ears. So the emphasis is on the automatic thoughts. So the patient needs to understand what is an automatic thought and how to capture that. And I often explain for them in this way that when, for example, if I am in this podcast and talking to you, my main cognitive platform, if you like, is focusing on formulating what to say and to try to make sense and communicate with you. But in the back of my mind, a less conscious part of my mind, maybe some thoughts going and come back, which are kind of out of my control. These are not the thoughts that I want to think about. The thoughts that I want to think about is how to speak with you and how to explain this problem. But those thoughts goes in the back of my mind and I hardly notice them. For example, what if I say something wrong? What if there is a patient with tinnitus who feel distressed based on the things that I'm explaining here? What if there is a professional who the things that I say may not be so nice to them? And so these thoughts, I hardly notice them, but I may feel the effect of them on me. For example, during this conversation, I may feel a bit anxious, and it impacts on my feelings that I have, or it may impact on my behavior. Right. I may over-explain things, or try to over-justify things, or try to skip some of the concepts. So what I notice is the emotional and behavioral effect of the automatic thoughts as opposed to the automatic thoughts themselves. And this is the natural way. But in CBT, because the understanding is that these automatic thoughts has a direct role and we need to identify and modify them, the patient needs to develop skills to identify these automatic thoughts, which are usually very hard to. And that is why it takes time. So it is not a skill that comes to us naturally. And so it's an unnatural skills that they need to learn. But there are so many skills that are unnatural. Playing the piano is not natural, or swimming is not natural. You have to learn the theory, take the lessons, practice, and then you can do it.
It's like who who drove a stick shift car 200 years ago, right? No one drove a stick shift car 200 years ago. And it's become an absolutely natural skill that most of the people know how to do. And even quite automatically, right? Because if you weren't able to do the steering, at the same time shift gears, put clutch, brake, and accelerator, then you would have probably already killed dozens of people. If you didn't know sort of like, at least partly subconsciously, how you have to handle all these tasks at the same time, right? And there you have the perfect explanation for what you just told us. Yeah, absolutely.
Exactly. And that is why it takes time. So it's not a quick solution. People need to learn this skill, which they do not naturally have it. And and it takes time, but it is something, the skills that when they learn it, then they can use it in other aspects of their life, exactly the same as acceptance and commitment therapy. So these are the skills when they learn to manage their tinnitus, they can use it in other aspects of their life as well.
Yeah, I think a lot of the concepts that you shared are very, very much in line with what we would also try to achieve with people inside our community or the coaching. And I think one of the most important parts is what I see. I would be nice to get your opinion on this, but I think that many of these automatic thoughts are based on the worst moments someone suffered from tinnitus from, right? Especially at the start when someone has sleeping trouble and they have a bout of insomnia and then all that anxiety that builds up in the body, right? So these automatic thoughts are in turn somewhere in the back of the brain linked to these very, very negative emotions, and they keep coming back, and they want the attention very strongly. So like just an example, I would try to use the Instagram or Twitter methodology. I would tell people to sort of like gain a little bit of space or to acknowledge the existence of these automatic thoughts by, for example, hashtagging them. Say hashtag, in your case, if you say, or in my case, hashtag Hashir might think he's a young guy from Berlin how can he know something about tinnitus in these few years that he's been working with it? I've been working about it 30 years, right? So that might be one automatic thought I have, just to say it. And then, but it's my response to that thought that governs whether I'm going to act on it or whether I'm just going to acknowledge the existence of that thought and just, focus on what I'm doing here is having a good time and creating good content for people with tinnitus. So I would be interested if you think that is something that would be valuable for people to act like, or if it's something that you also experience, that people always go back to sort of the worst moments they have in experiencing tinnitus, or what is your idea on this?
Yeah, exactly. I do think that this automatic thoughts, there is some logic in them. So is based on their past experience or lots of different, like for example, if you are going to go get into a crowded bus, this is an example that Albert Ellis, the founder of emotion and rational therapy and also cognitive therapy partly, came up with, is the crowded bus. So you go to this crowded bus, you being poked in the back by someone's umbrella. Depending on what you think, you'll have a different reaction. Like, for example, you'll have a reaction to, you can get anxious or get afraid if you think somebody doing this deliberately. If you think this is a poor blind guy who is struggling to stand up, you'll have sympathy. So, but why would you have either of these thoughts? So lots of different factors can impact on this. For example, if you're walking to the bus and you see actually a disabled person, this can maybe encourage that thought. Or if you getting into the bus and see some young people fooling around with each other, and then that can encourage the other one that they may be doing this to annoy you and have a laugh. And your past experiences, your personality, all of these things hand in hand will basically led to development of that particular automatic thought. And usually it's out of your hands, which automatic thought you produce. Now, as you said, it is within your hands how to respond to it. And that is where the interventions basically come into practice.
Yeah. I have this is awesome. I have my own example. I always use the someone cutting you off in traffic. We already talked about the car, but I say to the people I work with, imagine you were sitting in your car and someone cuts you off. and they're speeding, and you have two ways to respond, right? The one way is to go like, oh, maybe they're speeding to hospital because one of their loved ones or their mother or father is dying, and they cut me off and they are having a terrible day. And you might feel sorry for them and say like, oh my gosh, I'm so grateful for my parents and my family. I love them so much. Or you might drive after that person, forced to stop them, open the window and punch them in the face, and then get accused of harassment and maybe even spend some time in jail or getting a hefty fine. So, you know, in the end, it's like how you relate to what you make out of the story, of the thoughts that start coming up when these like sort of like seemingly automatic reactions, right? Like we stand at that intersection, they cut us off, and it's like we have sometimes at first, maybe when we don't really know this much or not know much about our own automatic thoughts or how we behave as a person, then we become very impulsive, and then we very quickly like, you know, determine in going after that person and punching them in the face and landing in jail, or saying, oh my God, I love my family so much. They're so great. And what if this person's parent is just dying or something like that, or something terrible happened to them? It sort of like changes the whole chemistry in our body as well, right? One is compassion and being grateful, and the other one is pure rage and eventually maybe even committing a crime, right? So it's fascinating to me. It's amazing.
Exactly. I agree. And this is the beauty of the psychology of this, and how you can use the power of your mind to overcome a physical problem which the science of today does not have any particular solution for that. So this is something that happens to you, and so it's a pain, and as they say, is the pain is not your choice, but suffering is the choice. And that you make. You do have the pain, which is that tinnitus, but you can choose to whether suffer from it or not.
Yeah, it's like if you try to say like, I want to live a life free of pain, which is impossible for anyone. So then you choose not to live life at all. And it applies in so many other areas, and we behave like that in so many other areas. But for tinnitus, it's very, very different. So I always say to people, I mean, of course, for many people who might be early on in their tinnitus journey listening to this might be incredibly hard and painful to realize, but it's not the sound that is driving how you feel and relate to it. It's your own individual behaviors around your tinnitus that cause you all the distress. So it's not the sound in and of itself that is causing all of this distress, but of course, the way you relate to it. So therefore, it's also incredibly difficult, right, for someone to understand the concept that such a incredibly difficult condition where it's about the transitioning of a physiological signal, right? So sound pressure in the ear and from the eardrum, the cochlea being translated into an electrical signal, decoded by your auditory cortex, put into an electrical signal in your brain, and then presented as sound in the same way that whatever I see is light coming in through my eyes and then being interpreted by my brain. So anyone saying like, okay, we need a cure for this and this should be cured easily, why can't we cure this yet, is because it's incredibly complex and incredibly difficult. So you touched on it a little bit already. What is, if I can ask you, you tell me whether you want to ask the question, but what is your thoughts about all these different promising solutions out there and about this incredibly difficult phenomenon of tinnitus? Yeah, I mean, you and me, we might have our own approaches, and you have your approach, and CBT has been incredibly helpful for people with tinnitus. But what is your thought about all these different other tools and strategies and things that are coming out onto the market, or a potential cure in the future? What is your expert?
Yeah, is a lot of things. I hear sometimes people do not want to do a therapy and object therapies like CBT. They say, oh, if we do this, then we are delaying the science to find a cure for tinnitus because we learn how to cope with it. And I don't really agree with that, because the science goes ahead whether you suffer from tinnitus or not. You still need to lead your normal life, and you can use the therapy, lead your normal life, and then help for the science as well. So you don't have to go crazy for the science to be able to, move forward and find a cure for tinnitus.
For sure.
And the science is moving forward, but it is very slow because, as you said, it is a very complex phenomenon. And all of those things that you mentioned about the sound waves going into the eardrum, vibrating it, effect on the cochlea, and the cochlea sending the electrical signals into the nerve, and the nerve goes up to the brain, and the brain says, yes, there is a noise there. None of those things are happening for tinnitus, except from the final thing that brain says, yes, there is a noise there. So we don't really know on what basis the brain thinks that there is a noise there when there is no signal going up from the ear to actually trigger that. But for some reasons, the brain is thinking that there is a noise there, but there is no noise there. So I often tell to my patients that tinnitus is a noise that you perceive, but it doesn't exist. So you are hearing a noise which doesn't exist. And sometimes people don't like that, say, oh, you are downgrading tinnitus. You are saying it doesn't exist. But one patient once said to me that he found this very encouraging. He said, well, I'm not going to let this noise, which even doesn't exist, to ruin my life. And which I thought it was a positive thing. But the noise itself, there is no noise, the perception of a noise, but there is no real noise in majority of people. There are some people that they have objective tinnitus, less than 1% of the tinnitus population. There may be a real source of noise. And there are a majority of people with tinnitus, there is no real sound. There is just a perception of a sound, but there is no sound. And that's consistent with the definition. There are a lot of treatments. Majority of them are very strange and hardly scientific, like laser or ear candle or a massage of some sort. And so these are, or some pills. Anything that exists, you name it, they've tried it for tinnitus, from epilepsy medication to antidepressants, to so many different things has been tried for tinnitus. None of them actually have shown that they actually do anything to the tinnitus. There are some recent interventions. They are not recent. They have been recently used for tinnitus, like electrical stimulation combined with noise or without noise, or the noise itself without electrical stimulations. This sort of interventions has been used for other psychiatric illness. Even deep brain electrical stimulations has been used for some forms of depression. And the psychiatry community is moving fast away from this type of interventions, but because they have this novelty in the field of tinnitus, some people buy into this, is mainly from perspective of research to actually find out whether this impact on tinnitus, but none of it actually have shown to have any reliable impact on the tinnitus. And so there's really no physical intervention that I would actually recommend for tinnitus at this stage. But it doesn't mean that the research is not going on. The research is going on, even on various different equipment, but it has to get to a place that they can find, okay, I use this, and your tinnitus automatically reduces by X decibel, if you like. And
which is difficult again to measure in decibel, right? If we measure something that only exists very subjectively, so we can maybe measure perceived severity, but it's very difficult to this is what I understood, right? It's very difficult to measure subjective decibel levels, right? You could maximally, you can say maybe to a person, okay, this is what 5 decibel between a sound that I'm playing to you sound like, so you can tell us, is this what you experience in reduction? But yeah, I think everything makes perfect sense. I think this is very, very helpful also for the people out there. I think one of the first things, in order not to be so impatient and to say you should not sacrifice your current life for some future potential cure, and not obsess and be upset about the scientific community, because I mean, I've had many of those people from the scientific community on my podcast already, and there are all these explanations for why it is so incredibly difficult. And you must also see, when you deal with something that is so incredibly difficult to create, and if there's has been so much trial and error and nothing has shown to bring lasting results yet, then you need to make it safe and effective at the same time, right? You don't want to get rid of your tinnitus, a benign body sensation, at an 80% chance of developing brain tumor within 6 months afterwards, right? I'm sure there are people out there who would take the risk, but I certainly wouldn't. And I'm deaf on one ear. I have very loud tinnitus when my hearing aid's not in, but I'm perfectly fine. I prefer to live my life like this rather than subjecting myself to a 80% chance of getting a brain tumor, right? Of course, I would like to get better hearing because my hearing is shite, to be honest. But that's the only thing. Like, I luckily have my hearing aid, and the rest we'll see in the future if hopefully something comes up for hearing loss, and maybe that also will help tinnitus. But it's something that we have to be mindful of, and we have to make use of all the fantastic approaches that we have. And I believe that people who don't really understand, maybe you have this phenomenon as well. Sometimes I have a first coaching call with a person, and they're just not ready to try this approach because it feels like losing. When they start to accept that I'm going into behavioral strategies of changing the way I relate to it, instead of trying to get rid of it, I'm not yet ready because I'm trying to full force continue to pursue. And then 3, 4, 5, 6 months later, they come back and say, I'm very exhausted. Can we please maybe try and start? And maybe then they are at a different place, right? So people sometimes just need to be at a place where they can say, well, if I can change my reaction and lay down my guns rather than going to war and spending 90% of my energy fighting tinnitus every day, then finally I'm at a place where I can sort of learn these kind of tools and strategies.
Exactly. It's sort of an instinctive reaction that we have when something happens. We want to get rid of it. Yeah. But our instinct do not always tell us the best course of action. And then, I always tell people, there are various options for tinnitus. If you feel that you want just to be distracted from it, certainly you can use various sound therapy methods. If you want to do more intensive experimental things, just do it. So it's up to you what you want to do. What I offer and I recommend is this method of cognitive behavior therapy, that it does this and its aim is this. And so if you want this, we're happy to help you. If you want other things, just go and do the things that you like to do. It's a free country. And then in my one good thing about CBT is that a lot of self-help things can help. And this is a book that we written not long ago. It was published in November last year, and earlier this year in the US, and Living Well with Tinnitus. And it gives people an outline for cognitive behavior therapy and how it can be used for managing their tinnitus, and for professionals who are interested to learn more about this, how to help their patients. We're doing a tour of international tinnitus workshops starting in Norway and continuing to Middle East and South America and back to London. And information about these tinnitus workshops are on my website, which is hashirtinnitusclinic.com, and for people who are interested.
That is fantastic, and I'll make sure to include that in the description to the episode as well. So if you're listening to this on your favorite podcast platform, then make sure to check out the description, because Hashir has shared all of these resources with us. So the book is called Living Well with Tinnitus, right? So
that's right, yes.
Living Well with Tinnitus. Okay, people can find Living Well with Tinnitus, and we will also share the resources for the conference in all these different regions. Hashir, it's been absolutely a very, very big pleasure to have you on the podcast today. One of my final questions that I like to ask my interview guests is that if there was anything with the world that you would want to share, maybe on a massive billboard on Times Square or in the middle of London, what would you like to share with the world or the people who deal with tinnitus right now? Is there something that comes to your mind that you would like to share with the audience right now?
Oh, that's difficult. So one liner for the tinnitus patients.
Yeah, pretty much anything that you think would be would be worth sharing with the people who are dealing with tinnitus? Or maybe also, sometimes I get feedback that people who have someone in the family who's going through a difficult period with that tinnitus. So, the listenership it's amazing. It's expanding. People writing me saying like, oh yeah, my grandpa who died 10 years ago, he had tinnitus, and now suddenly I found this podcast. So I'm like, wow, that's crazy. So literally anyone can benefit from this, and it's an inspiration, and it's very nice to have you. So I wanted to ask you whether you have one thing, one line, one sentence, something out of your professional or personal life that you want to share with the people.
Yes, I think that's something that I'd like to convey to people, is that the solution is within you, and that's where you really need to look for it.
I love it.
And this is consistent with our CBT or mindfulness or ACT therapies as well. So people have the experience of living, and they know where their weaknesses are, where their strengths are, how much pain they endure throughout their life, how they coped with the previous problems. So there are a lot of things within them that they can find. Even the concepts of CBT, ACT, mindfulness, these are not extraordinary rocket science, if you like. These are the things that people use, a lot of them unconsciously in their day-to-day life. So I would say the solution is within you, for my one-liner.
I think it's fantastic. And if people had more trust in that, then it would be easier to deal with many things. But yeah, sometimes it's difficult to get lost in all, not only automatic thoughts, as you so well described it today, but into all the different things that require our attention in our busy modern lives. Hashir, it's been an absolute pleasure to have you on the show today. Thank you so much for coming on. We, of course, want to thank you again for all the time that you devoted to this episode today. We would love to have you back on the show in future. Maybe you can talk about your conference again, or you can even share a little bit about your book. And for everyone who's listening to this, thank you for tuning into this week's episode. Thank you, Hashir, for tuning in today and being with us today. We are very, very grateful for your time.
Thank you, Frida, and thank you for the listeners for their time.
All right, here we are back again. Thank you for tuning in for the version with Hashir Aazh, the tinnitus specialist and tinnitus and CBT expert from the UK. If you want to listen to the whole version of the podcast, just search for the Outring Tinnitus podcast. Go to the link in the description below. You'll find the link to the podcast, and then you can listen to the whole hour-long podcast version. I think it might be very beneficial. You can check it out if you want to. You've heard Dawn, our Tinnitus Club member, share her story and share her insights from inside the community and everything that she's thinking about our community. So yeah, if you want to get better with your tinnitus, get closer to habituation, and really make some large steps towards putting tinnitus where it belongs, in the background, then go to the link in the description as well, and you'll be able to sign up for a free trial. And as a limited time offer only, I hate all the sales talk, but I have to do it because I want to get you to get better with your tinnitus. That's why I'm doing these kind of things. But you'll get my book for tinnitus for free. So you get my 8 weeks Accepting the Unacceptable book for free if you sign up for our community. And all those links in the description. And of course, also some free resources, because if you're not sure whether this is the right thing for you, then you want to be reading some free resources. And I've previously made videos on the hacks here on this channel as well. So you might want to check out the free 100 hacks towards tinnitus habituation, or my free emergency guide to tinnitus. And I am working on a 7-day challenge as well. So keep a lookout in the next few videos on my channel. I'm going to share a 7-day challenge with you that you can complete in order to move yourself a little bit closer to tinnitus habituation. My name is Frieder. I was born deaf on my left ear. I live with a pretty big, but right now off hearing aid because the battery just turned off on me. Anyways, I don't need that in order to talk to you. But I've been living with that for the last 15 years, and been coaching people with tinnitus and founding this community a few years ago. I'm relatively good at it, I can say. As you heard in the testimonials. All right, guys, I wish you all a fantastic weekend. Friday is YouTube release time, Friday evening. So keep on looking out for that. And I'm doing a few more lives in the next few weeks. And eventually we'll also have a live Q&A session where you can join us live on the channel and ask your questions about tinnitus. And Yeah. Wishing you all the best from my heart to yours, from Berlin in Germany, from raining Berlin in Germany, and cold and autumny weather. I'm wishing you a fantastic weekend to wherever you're watching this from. Bye.